Hi, I'm Danica Koopmans.
And I'm Sharon Hughes-Geeky. We're your hosts of Docs of Vernon. This is an interview and podcast series designed to help you navigate the healthcare system and get to know the physicians that provide your care.
Topics include what the heck is a hospitalist, treating addictions, and alternatives to going to the ER, plus so many more.
This is your link to healthcare in your community.
Today, I have the pleasure of interviewing Dr. David Grynspan. He is a MD-FR CPC specialty trained pathologist. We'll talk about what that really means in a sec. He also has a fellowship in pediatric and perinatal pathology. His biggest passion in pathology is maternal and fetal health, and he works with staff and students on research and teaching specific to maternal and fetal health at UBC Okanagan. In his time outside of medicine, he has 3 beautiful daughters, Stella, Gabriella, and Sophia. He loves spending time with them and going for walks on the trails, reading, and a passion for music. Welcome, and thank you so much for being here.
Thank you so much, Danica. That was a lovely introduction.
So I got to ask you, just to clear get full clarity here. So what is a pathologist?
So a pathologist is somebody who studies disease by looking at tissue that comes from a person. So that would either be a surgical specimen, a part of a person that's taken out of the operating room, or a biopsy, which is like a little bit of person, a little bit of you that's taken out by the doctor and sent to the lab. And that's mainly what we do. And we look at it in various ways and try and see if it's healthy or if there's a disease there, and then to try to help the clinical team know how to treat that disease.
So a day in the life of you at work would include, what does that look like?
Most of the day is actually spent looking at glass slides in a microscope like this that are made from those bits of tissue that come from people. So for example, let's say the medical team finds a lump or a mass and they take a bit of tissue and they send it to the lab. It gets made into slides, and we get a lot from not just Vernon, we get it from the whole surrounding area. And so there's actually a lot of them. And so most of my day is spent looking at glass slides that are made from these parts of you that come to the lab. And then there's various different types of stains and stuff we could do to those glass slides. So my day is spent looking in the microscope at those slides. Sometimes we actually go down to the lab and look at the specimens themselves. Let's say the surgeons take something out in the operating room. We could go and look and then, process it in certain ways, dissect in certain ways. And then other things that we could do with other types of special tests or procedures. For example, looking in what's called a dissection microscope, looking at images from an electron microscope.
So I always found it really interesting when I was at the hospital and I could just hop over to your office and say, okay, so this is the case, this is the patient, here's, you've looked at a specimen on this, and we could actually, as a colleague to colleague, have a conversation and you would offer those teaching moments. I think that's super valuable to just tie into this interview, is how much of a team it takes and how much you are a part of that team, and not just the patient side of it, but also teaching your colleagues, right? Because it is a specialty. And again, I really don't know what a pathologist does. I didn't ask that question. I need to understand too, even working alongside you, right?
Yes. And so, look at the concrete example, let's say you're looking after a patient who has many complex medical issues on the ward. Maybe you're using various medications to treat him or her. Maybe you've recently added an antibiotic, and now suddenly they break out in an unusual skin rash, just as one example. And you're wondering, what caused this rash? Is it a reaction to one of the drugs that I'm using? Is it part of the initial illness itself? Could it be an infection or another virus? And let's say you decide to do a punch biopsy, and that's happened. And then I could look at it under the microscope, look at the biopsies that you take up on the ward. But when I'm looking at that biopsy, it's much better if I'm not looking at it in isolation, and if I understand the clinical story of what you're dealing with. So that when you come to my office, which we've done many times, and you tell me, this is, and you give me the person's age and their underlying condition and their course in hospital, the treatments that you're doing, why you did the biopsy, and what you're trying to solve, what you're trying to sleuth out. Maybe it's a reaction to the antibiotics. Could it be part of their systemic disease? Could it be a virus? And you give me the context that helps me apply an approach to what I'm looking at, and we can almost sort it together. And we each bring in our content expertise, where you're bringing in the content expertise about the patient and their clinical circumstances and the meds, and I'm bringing the context expertise about what do the cells on the slide have to say about the various options that you're proposing.
So it is quite complex. It's not just, looking under slides, although the intricacies in there, I barely could even grasp that. But it's the patient on a whole. And I think that leads me to my next question. I used to kind of think like, pathologists, they just deal with dead people. And it's such a disservice to the profession when we have this misunderstanding or misinterpretation of what the role really is, because meeting you and understanding what you do, even on a small scale, there's so much heart behind it.
Sometimes, in the day, when the days are long and you're looking at lots of slides, sometimes it almost gets overwhelming and you almost forget. So it's almost like you have to actively remind yourself that what you're looking at is a part of a human being who may be suffering, and that you have the capacity, not by yourself at all, but to work with a team, with people such as yourself, to contribute to the alleviation of the suffering of a human being. And so one of the important things that you always have to remind yourself is that you have the responsibility that somebody's pain, somebody's suffering, even if it's disembodied, has been brought to you. And now you're the custodian of that. You're sitting and holding their disembodied suffering, and you need to step up and contribute to the team, even if you're tired, even if you're frustrated, even if your computer is not working, even if some days you feel unsupported or whatever it is. You have to put all of that aside and say, it's not about you, David. Like, there is a human being there who entrusted you with their disembodied suffering. And worry, right? Because the people are also worried. And I know that from personal experience. You notice a lump, you notice a mole, you notice something that doesn't seem right. Until you get that answer, whether it's benign or malignant. And even if it's malignant, at least knowing what to do about it. There's this limbo phase where you don't know and you're really, really worried. And so not only are people bringing us their suffering, they're also bringing us their worry. And we're sitting on that. We're responsible for it. We're being the custodian of it. So one of the things that I always have to remind myself is that attached with these hundreds of glass slides are human beings, mothers, daughters, just like my own, who are worried and who are potentially in pain and who are suffering and who may be even confronting issues as grave as mortality. And so that's the first issue that we have to constantly remind ourselves. And I think the second issue that we have to remind ourselves is that it's not the same as working with objects. You're working with, parts of a human being. And so not only is there the implication of the help to the person, but the tissue itself has a metaphysical or symbolic value. It's not like working with computer chips. It's not the same as working with objects. It's working with something, if I could use the word, slightly more sacred, or something, at least let me say the word, something that's metaphysically different and that calls for a degree of respect, a degree of decorum, a degree of devotion. Even with all of that, the work becomes quite technical. And so what really is so important is when our teammates, people like you, come to the door and tell us what the other side of the story is. And that shifts our focus, and that gives us the emotional resolve and the strength to be able to continue, because that reminds us that we're not just writing reports, we're helping the treatment of a sick and suffering person.
That was said so eloquently and profound. If I had a video team, I'd be like, you got that right. Good thing this is recorded, because what I really heard you saying is taking yourself and what's going on in your mind in a very analytical profession, in a very research, decision-based, data-focused, microscopic, really, way to humanize each piece of tissue and understand that from a heart-centered approach and holistically looking at each slide. And I think that is incredible that you're doing that. And I'm sure that comes with its own set of challenges. So,
And that's another dimension to it. Like even when you're looking at the slides, and I think one thing that I should say is that like a lot of the biopsies that are done is worried about cancer. The underlying concern is cancer, where pathologists are often called upon if there's a lump or something, not always, there's a lump or something, and the underlying concern is, could this be cancer? So of course you want to fight the cancer and win. First, you don't want it to be cancer, and if it is cancer, you want to find targets that you could treat. But a subtext to all of this is it's opening a portal to discussion of potentially to discussion of mortality. Because the second you start talking about cancer, you start talking about the potential for a discussion about mortality. It actually is helpful diagnostically to look at it not only with your mind, but to look at it with your heart. Sort of like when you look at a painting, like, you know, you could tell, okay, I'm looking at the painting of the monk, you know, holding the skeleton, whatever, the monk is holding a skull in the painting. And you could tell me how long is his arm and how long is his robe and what color is his robe and what color is the background, you know, in this El Greco painting. That's actually a real painting in the National Gallery in Ottawa. And so you could describe it. You could describe the dimensions of the monk, the dimensions of the skull.
you can see his passion coming through now. It's like, I love when you get on these, keep going.
But yeah, but you know, and that's a reductive way of looking, you know, but then you could always say, like, does it make you feel any fervor? Does it make you feel any doubt? Does it make you feel a sense of mystery? Does it make you feel a foreboding? Does it make you feel a sense of even faith? When you look, you feel, and you know, and you can't reduce. So there's a reductive and a non-reductive way of looking. And I think in pathology, and probably the most beautiful thing about pathology is that we get to do both.
Absolutely. Wow. I feel like that's such a beautiful place to end, but I want to give the opportunity if you would like to share anything else on the subject of pathology and a day in the life with you and what your job looks like, or anything that you really wish the public could understand and know about your profession.
I think people have the experience that they, have experience that, let's say, they'll have a mole or a lump or something, and then they'll be told by their doctor, we need to take a piece, and then it goes to a lab, like an unseen lab, and then they're waiting for the result. And often, to be honest, I'm aware they're waiting too long. And so we have to cut down on the turnaround times. And that's, a technical issue, and it has to do with the process. And it's something we definitely do need to work on. And so I want to tell people that I want to work on that, and that it's good that what you're doing, because then I'm not faceless anymore, and maybe people can even approach me, because we do need to alleviate anxiety by going faster. And the other thing that I want people to know is that it's not like a invisible box that their specimen is put into. It's like there's a person who cares about them at the other end. And for all of the frustration of waiting and sometimes the reports are unclear or difficult to interpret or lead to more doubt. So the lab is sort of sometimes like this box of frustration, this thing that consumes time and doesn't necessarily give great answers. And that's actually true. And those are the limitations, and I apologize for those limitations. But then at the very least, that behind all of that is a human being who's aware of the limitations and who cares about them profoundly and who wants to help them as much as possible. And there's all these systematic constraints and layers in between me and the person that I'm trying to help. But I wish that they could feel my sincere desire to be present with them and help them.
I know why I love Vernon, but why do you love Vernon? I know you mentioned you love, being engaged in music, and just share a little bit more about outside of medicine, what do you love?
Absolutely. So I love music, and there are, lovely people that you could jam with here. There's always, there's lots of interested people. You could just set up a little jam session. The hospital community, you could socialize with each other. You could go for walks on all the various trails. Faith is an important part of my life. So when I need to reach out, there's a lot of wonderful faith communities and resources, places of worship, places for meditation, places where you could reinvigorate your faith. colleagues and peers who can help you with that. And this Vernon beautifully does have that. More, I've lived in many places, and that's something that Vernon very strongly has to offer is fellowship and community at a level that's very, very beautiful and strong. And I could even disclose that I've gone through some difficult times, and having that fellowship and community with communities, including intellectual communities, faith-based communities, common interest-based communities, all of which are so beautifully and strongly present in Vernon, has got me through and strengthened me and enabled me to be stronger into myself, and also to be a better parent and have better bonds with my children, which I think is extremely important to me. So Vernon, it's a family-oriented place, and it's a place of community, and it's a place where whatever your communal desires are, wherever your communal heart is, there will be a like-minded and supported community in Vernon.
So this is the end of our interview. I just want to say thank you again for being here with us today. And to have more information, or if you want to connect with David, or you want to connect with the Docs of Vernon, please feel free to reach out. You have all the links in your under this video, I guess, and also in your emails and on Instagram. So we will find you there, or you'll find us there, and we look forward to staying connected. Bye for now.